Hey guys, so today I wanted to talk about another avenue of things that I do at my practice, and that is pre surgical screening for bariatric surgery. So, before you qualify to be able to have the gastric bypass or the gastric sleeve, you have to have a psych eval, which a lot of people are confused by to say, well, it's an elective surgery. I'm confident in my decision. Why do I need to have a psych eval? Which is a legitimate question and one that I can answer. So, previously, as a method of weight loss, there were a lot of instruments used that were not permanent, like the lap band or the gastric balloon. But especially now that they've developed the gastric sleeve, um, those products are not usually used anymore because of complications and because it's a foreign instrument in your body, and honestly I also think because we've developed better ways. But the surgery is quite permanent. So with the sleeve, they're removing a portion of your stomach, and with the bypass, they're rerouting intestines and things like that. And so, as opposed to an appendix surgery, which I've had, where there aren't very many rules to follow afterwards, with the weight loss surgery, there are. So there are a bunch of rules post surgically that you have to follow about introducing solid foods and on what timetable. And there's a lot of dietary changes that you have to make, and there's a lot of little things too, such as nicotine is a big no-no, so you have to stop smoking if you're going to have the surgery, and post-operatively as well, which is difficult. And then also there's little things like you're not supposed to eat and drink at the same time, and it's actually pretty nuanced. So part of my job is making sure that you understand what you're getting into, and that you're aware of those restrictions, because obviously we want you to be as well informed as possible before going forward. And then a lot of people are really nervous to see me if they have any sort of psych history, but really what we're looking for is, do you need extra support after surgery? Your medication dosage might change. You might be more at risk for post-surgical anxiety if you have a history of anxiety. But the point is not to deny you for the surgery. The point is to make sure that you have all the resources that you need. And if you are at a higher risk for having any sort of complications, psychological, medical, we want it to be as successful as possible. So we want to make sure that we give you the best care. So it's never something to be anxious about. It's not something you need to be nervous about. It's just me asking you questions about your diet history, your psych history, how the surgery's been explained to you. But I know a lot of people come in with questions, and so I just wanted to kind of address the purpose for it. So I hope that that makes sense to you and is put in a way that will help put your mind at ease, that it's not something that is just like a stamp of approval or disapproval. It's more just making sure that we've assessed you as an individual to make sure that this procedure, which is expensive and time consuming in most cases, is going to be successful. So I'm on your side. I want it to work. I'm excited. I think it's great to take preventative measures for your health. It's always better to be proactive rather than reactive. So I'm excited for you. I just wanted to clarify that that's the point, so that hopefully when you do come and see me, it'll help ease a little bit of that anxiety for you. So I hope you have a great day, and that I'll see you for your pre-surgical assessment. Bye.